The World Health Organization on November 17, 2020, launched its global strategy to accelerate the elimination of cervical cancer. The strategy outlines that successful implementation of vaccination, screening, and treatment for the disease could reduce more than 40% of new cases and 5 million related deaths globally by 2050. The health agency further outlines that should countries achieve certain targets by 2030, it will place them on a path towards elimination. The targets are 90% of girls fully vaccinated with the HPV vaccine by 15 years of age, 70% of women screened using a high-performance test by age 35 and again by 45. 90% of women identified with cervical disease receive treatment, 90% of women with pre-cancer treated, and 90% of women with invasive cancer managed. The plan also stresses that investing in the interventions to meet these targets can generate substantial economic and societal returns. However, Guyana has a far way to go to meet these targets, according to coordinator of the VIA program at the Ministry of Health, Dr. Martin Campbell. Dr. Campbell, during a recent interview with Nightly News, informed that the Ministry of Health is currently in talks with the World Health Organization on new initiatives that could be implemented to help Guyana eliminate the disease. He disclosed that an estimated 31% of girls in Guyana have been administered the human papillomavirus vaccine by the age of 15, and 29% of women have been screened using a high-performance test by the age of 35 and again by 45. He noted that in the area of treatment, much more needs to be done as well. Dr. Campbell divulged that the ministry is working on several new interventions to reduce the incidence of cervical cancer. One such intervention is making the pap smear testing methodology more readily available in the public health system.
The major bottleneck with that is having the results read, because that has to be done by a pathologist, somebody's trained specifically for that. And as you know, training and that area is a little deficient.
Additionally, he said that establishing more testing sites across the country is priority.
We actually have 22 sites presently in the public sector, and of course in the private sector there are a few more. Because of COVID, we're only having about 15 of them active, and that has to do, apart from the fact that facilities might have been used for other purposes, but also the staff would have had to have been reassigned to assist with the current pandemic.
In terms of treatment and diagnosis for the disease, the Georgetown Public Hospital is a central referral institution which offers free services. The two main testing options for cervical cancer is the visual inspection with acetic acid and pap smear. Public medical institutions primarily offer the VIA testing, which provides immediate results. The VIA testing methodology is recommended for women below the age of 49 years, while the pap smear is the first choice for women who have gone through menopause. Temika Rodney reporting for the HGB Nightly News.